Good evening. Today is April 4, 2020, and I am Heerak Christian Kim, an independent candidate for U.S. Congress in Virginia's 8th District that includes Arlington, Alexandria, Falls Church, and parts of Fairfax County. And I'm here to give you a coronavirus update as a community service to you so that you can understand what is happening around us and so that it will help you to survive. In a single day, since yesterday, 1,100 Americans died from COVID-19. So you can see in the United States, yesterday, Friday, April 3rd, 7,406 was the total number of Americans who died from COVID-19. But today, Saturday, April 4th, 2020, the total number of deaths from COVID-19 in America is at 8,407. In terms of confirmed cases, in the 24-hour period, total confirmed cases went from 276,995 to 308,850. So an increase of a little bit more than 30,000 cases. So it's very serious right now in terms of number of deaths. So if we keep going at 1,000 deaths per day, in 1 month, you're going to have over 30,000 people dying. So in the month of April, you could have 30 people dying. In the month of May, you could have 30,000 people dying. So that's 60,000 total, right? And by June, if we keep up the same rate, we will have 90,000 people dying, and so on. So you can see what can happen. And the numbers may not stay the same. For instance, Governor Cuomo said hotspot in Long Island is drastically increasing number of cases there. So we can see a spike in death in New York State, and other states may see a spike in deaths as well, especially Michigan, Louisiana, Illinois, and maybe California. And so by August, it is possible that we can easily have over 200,000 deaths. And it's possible we may have much more than that, in the millions. It depends on how fast the death rate increases and how many people in each state become infected and how many PPE, personal protection equipment, hospital beds, and nurses and doctors are available to treat the patient. And there's a lot of factors. Today, we're going to compare different nations and total death rates. So I have ranked different countries by their total death rate, regardless of how long the country had coronavirus. China had the longest, but you see that China is not in the top 6 list, maybe because they wore masks early on, and they were strict about wearing masks wherever they went. And as you know, I've suggested that from the very beginning, that everybody should be wearing masks whenever they're outside of their home. Right now, the number 1 death rate, total death rate, is Italy at 15,362 deaths. Spain is number 2 at 11,947 deaths. And somehow United States became number 3. And now we have 8,407 deaths in the United States. That's Americans dying. Over 1,000 Americans dying every day. France has 7,574 deaths. United Kingdom has 4,320 deaths total so far. Iran has 3,452. Today we're going to talk a little bit about infection control because people talk about all kinds of things and you may not quite understand what the terms are referring to. And I feel like if I can explain things to you, your life would be better because you will understand exactly what people are talking about when they talk about surgical mask or N95 mask. I'm trying to help you understand coronavirus so that you can survive this thing. Definitions and understanding the terminology is important. So hopefully this will help you. Now, when we talk about N95 respirators, you see the lady on the photo, she's wearing an N95 respirator. It fits tightly onto her face. As a Master of Science and Nursing student at Georgetown University, I was required to go and get my face fitted for N95 mask. Generally, we use N95 mask for patients who have tuberculosis, TB. And in Arlington, TB cases are fairly high compared to other parts of Virginia. And so I got my mask fitted for tuberculosis, but now I'm finding that we can use this for coronavirus. So what is an N95 respirator? You see the photo right there. N95 respirator is a special kind of mask that fits onto your face, and it is meant to block out particles that are 0.3 microns. That's a measurement that measures something very, very small that your eyes cannot see. To give you a reference, a bacteria size is about 1 micron. So with an N95 respirators that block out up to 0.3 microns, it can block out most bacteria because they're generally 1.0 microns. And before I go further into discussing viruses, coronavirus is a virus, we need to compare bacteria and virus. A virus size is much smaller than bacteria. So virus is about 100 times smaller than bacteria. So a virus size can be anywhere from 0.004 to about 0.1 microns. So some of you have already done the math. N95 respirator blocks out particles that are about 0.3 microns. However, viruses tend to be much smaller than that. And even big viruses are 0.1 microns, which means none of the viruses would be necessarily blocked out by N95 respirator 100% effectively. To add insult to injury, the reason why the mask is called N95 is because it only blocks out about 95% of the 0.3 micron sized particles. Now, virus is smaller than that at 0.1 microns. So there's a problem, as you can see. But even if coronavirus were above 0.3 microns, only 95% will be blocked out, which means 5% will get through. To give you an illustration, how many people would buy a condom people say is 95% foolproof every time you use it? So that kind of gives you a reference point. That is to say, even if you wear an N95 respirator, you do not have guaranteed protection against a small virus. And there's another problem. When nurses are taking care of patients, the masks move around in her face. So yes, the mask is to fit firmly against the face, but if the patient needs to be moved and the nurse is working hard to intubate the patient, put the breathing tube down the patient, it's difficult physical activity. And the nurse may be very tired after 11 hours of working nonstop to help COVID-19 patients. So the mask could move around because she may be sweating, in which case coronavirus can enter through the openings that are created by the nurse's sweat or movement. So you can see how easily nurses can get infected, even wearing N95. Obviously, it's better than a surgical mask. Surgical mask you see on the left of N95 respirator, and that's that's the mask that people generally wear to protect themselves from bacteria. But coronavirus is a special kind of virus. It's not just infectious like other viruses. It is highly infectious. Some say they have never seen anything like it. It's far more infectious than influenza A, influenza B. Some say far more infectious than H1N1, anything that we have seen. And so even though we may use a good respirator, like N95 respirator, which is among the best in the industry, it may not adequately provide the protection that nurses need not to get sick. And that is why 11,000 healthcare workers, doctors, nurses, got COVID-19 in Italy. And some of them have died, others will die. 11,000. That's an astounding number. And these are doctors and nurses who wore N95 respirators. Some of them might have worn surgical masks if they ran out of N95 respirators, but they had protection. Obviously, you can wear a hazmat suit or something that provides greater protection. And in China, they used serious protection far greater than N95 respirators, which we know now, since I gave you the facts, can't really block out viruses which are 0.1 microns, because N95 respirator blocks out 0.3 micron particles. But it's hard for the virus to find an opening in. So when we treat tuberculosis, TB, we wear this N95 respirator, and we generally use a negative pressure room. If you see on the screen, the little green box, that represents a negative pressure room in a hospital. Not every room in the hospital is a negative pressure room because it is very expensive to fit the room to be a negative pressure room. So what is a negative pressure room? It's a room that sucks out the air and throw it outside. Do you see the blue arrow? So air from the hallway of a hospital could go inside the room, but because it's a negative pressure, room has equipment that sucks the air from the room and throw it outside. And you see the blue arrow going outside. Generally, in a given hospital, only few rooms have negative pressure because usually only tuberculosis requires negative pressure. Other kinds of bacteria and viruses generally do not require negative pressure room. But coronavirus is highly infectious. And unfortunately, scientists do not know exactly what it is. They don't know what it does, how it transmits exactly. They just don't know much about it. It's completely new. It'll probably take at least 10 years to understand this virus fully, maybe longer. And so right now, most scientists are walking in the dark and guessing. It's kind of like an educated guess or hypothesis. They're guessing like, oh, it's probably like this based on other viruses. But it's not really like other viruses. So that's the problem. Now, in terms of you, your father, mother, your children, here is a serious problem because hospitals only have few. When I say few, we mean like 4 or 5 rooms. If it's a decent sized hospital that have negative pressure that sucks the air out, which provides maximum potential protection against tuberculosis, and in our case, coronavirus. Not everybody can be sent to that room. Probably President Trump, if he ever gets coronavirus, will be sent to a negative pressure room. Vice President Pence. But there are a limited number of these rooms. And unfortunately, there are still tuberculosis cases in Arlington, Alexandria Falls Church, Fairfax County, and throughout the United States. And so they need these rooms for tuberculosis because that's a highly infectious problem as well that you don't want spreading in the community. And so most likely, most hospital will reserve negative pressure room for tuberculosis. Now, what does that mean? If nurses have to work in a room that doesn't have this special mechanism, wearing 95 respirator that generally disposes of particles around 0.3 microns, when virus is 0.1 micron. I mean, it will anything covering your face will help to block things out. But obviously, it's not going to protect you 100%. Even if it were 0.3 microns, it only protects you 95%. And that's why it's called N95, not N100. And so they do have N100 masks, but they're not 100% foolproof. They're more like 99.9% foolproof, but they're called N100 respirators. And obviously, they're incredibly expensive, incredibly hard to make. But anyway, so we are stuck with N95. And so what this means is most likely we're going to have tens of thousands of nurses infected with coronavirus at some point. I mean, Italy is a small country compared to the US, and it has 11,000 healthcare workers infected with COVID-19 already. And so you're looking at maybe in the United States, if this keeps continuing, maybe even over 100,000 nurses getting COVID-19, and those who have underlying conditions like diabetes, high blood pressure, asthma, if they're overweight, they may die from it. Europeans tend to be a little bit better about weight control than us Americans, as people who've been to Europe know. So their chance of survival is probably much higher if they get coronavirus. But anyway, so this kind of puts things into perspective. And so obviously single rooms are better for patients than mass large rooms where coronavirus can just, mingle and mix and multiply. and infection is harder to control. But as you can see, this explains why so many people are dying, because even when they go to the hospital, if there is not negative pressure, um, patients who are immunocompromised, meaning they don't have strong immunity, can get infected with other things because there are a lot of bacteria and viruses. And normally in a given day, you'll be able to fight them off. For example, in your hands, you probably have hundreds of thousands of, far more than that, bacteria. But because you have pretty strong immunity, you're not getting sick now. But when your immunity goes down, the bacteria that's already in your hand can infect you and may even end up killing you because your immunity is way down. So, that becomes a problem when it comes to survival from coronavirus. So today I just wanted you to understand what the terms are, and so that when people talk in TV or radio, or when you read a newspaper, you kind of understand what they are. And also the problem with TV is they kind of superficially talk about things, which means you may not quite understand the implications and consequences. And it's important to have full information and data. So number one, you are aware that even if you're wearing a surgical mask or N95 respirator, you do not have 100% protection. And so you're going to be careful, right? And when you're walking around outside with a mask on, you still have to be careful, because even if you're walking outside with N95 respirator, you still can get infected. And so you got to keep that in perspective, because when you let your guard down, wearing a mask, whatever mask you have, then you may end up getting infected. So yes, make a mask because it's going to help you, right? Having a mask is far better than not having a mask. But just be careful. Just because you're wearing a mask, don't just think that you could do whatever you want. You got to be cautious, very careful. I want you to survive, and that's why I have created this program so you can be informed. I'm going to give you good advice. I hope you will subscribe to my YouTube channel. This is Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, Arlington, Alexandria, Falls Church, and parts of Fairfax County, wanting you and your children and your parents and your family to survive coronavirus. I hope that you will be well.